All right, lots of folks still coming in, so thanks for your patience, everyone. Okay, I think we can get started. If you have not met me before, my name is Libby Sagara. I've met many of you who are on our call. I can see lots of familiar names, but also some new ones too. I'm with Blue Path Health, as is my colleague Lauren Jacobson, who helps facilitate our eConsult coalitions, our Central Valley, North Rural, and Sacramento groups that have built over the past couple of years with support from Anthem Blue Cross and HealthNet. We are open to any FQHC, any provider who sees Medi-Cal patients, rural health, Indian health centers, anyone who is open to Medi-Cal patients, and we're here to improve access to care through eConsult. So if you're new to our group, thanks so much for taking a moment to introduce yourself. I see some new names popping in. Thanks so much for joining us. And Lauren, can you see my slides okay?
Yes, we can see your slides.
Wonderful, great. So as many of you know, you get our newsletters, our emails that mostly come from Lauren and me to let you know of the topics that we'll be focusing on a monthly basis. We like to be able to share examples of cases, best practices for eConsult use in clinics across California. And with our network ConferMED, we like to be able to share some case examples and good examples of eConsult in use. So today we'll be focusing on eConsult for diabetes care with Marianne McGuire from ConferMED, along with Dan Wilensky. We'll be sharing an example of eConsult, or a couple of eConsult case examples. And we'll just spend a little bit of time talking about other aspects of the program. If you're new, you may not be familiar with. And upcoming events. We have monthly and sometimes more than monthly events that talk about specific specialties that can be addressed through eConsult, different ways eConsult's being used in terms of improving access to care. So just in case you are new to us, I mentioned we started out in Central Valley forming the eConsult coalition to include, we started out with 6 clinics and now it's expanded to many, many more than that, as you can tell. We, from the successes that we saw in Central Valley, grew up to North Rural counties and also expanding to Sacramento. So all of this is made possible by support from Anthem Blue Cross, Calviva, California Health and Wellness, and HealthNet, along with bringing in other plan representatives so that we can make eConsult available to any Medi-Cal managed care patients. So it's been great to see it expand across the state. This is open to anyone who wants to join. eConsult is available at no cost to providers and patients. So this is covered through Medi-Cal managed care. And in addition, as many of you know, also through a grant from Anthem, eConsult is also available to uninsured patients, and we've seen that as a great resource across Central and Northern California. Many of you are, your patients and members are experiencing challenges in being able to access specialty care. It could be because of long distance in terms of travel or because of their coverage, and eConsult is one way that we hope to be able to help address that challenge. I know we have a good number of people on our call today. If you have any questions or comments, please do share them through the chat. We're happy to answer them. And if there are any questions for our plan leaders, we're happy to address those too. So just a quick little blurb in case you haven't seen this before. eConsult is sometimes something that's not necessarily familiar to patients. It's something that our providers as part of our group have asked for some tools to be able to talk to patients to explain better. So we came up with this infographic in partnership with our coalition participants to talk through the process where eConsult can help patients to get specialty advice more quickly than they would otherwise, considering standard wait times for eConsult specialties. eConsults, as part of this program, average response time is less than 2 days. So providers who send eConsult requests get that advice more quickly than they would otherwise, and patients then get that advice too. We work with our primary care providers as part of this group to provide tools and resources to incorporate this into their workflow. ConferMED ensures that the eConsult process mirrors the provider organization's referral patterns. And when we work to discuss eConsult, we just want to make sure that patients understand what's happening, that this is a piece of advice that will come back to their primary care provider and help them to determine next steps, and in many cases, helping them travel or helping them prevent additional travel to an appointment that can be dealt with through their primary care provider. We ask our primary care provider partners who are participating in the program to consider eConsult as the first step to a routine or non-urgent referral request or a non-procedural referral request. This is a goal for us to consider that every eConsult for many, many specialties that that the specialty list is numerous. We want all of our providers who are participating to be able to consider this as the first step. So this is not mandatory for primary care providers. They do maintain the relationship and they get to make the decision as to whether an eConsult is appropriate in the case of the referral need. Any questions or comments just about our program before we get started into our content for today? Okay, great. So just a quick little glimpse on what we're seeing in eConsult across our coalitions. This is data. Thank you so much for our ConferMED lead, Marianne, for providing the data that we see here. We're seeing some pretty strong trends in terms of the top 5 specialties across the state or across our counties that are participating. And we've seen a little bit of dip in terms of activity over time here. I noticed too, a lot of people are out. I'm sure primary care are also experiencing a lot of providers being out. It's vacation time. Patients and providers may be less active or less present in the clinics. But you can see that we had a big peak in May and a little bit of a summer dip, but we hope to see eConsult use pick up a bit as everybody comes back from where they may be traveling. Just a quick glimpse, this is North Rural, so our counties north of Sacramento, Central Valley, pretty steady actually, interestingly. And then Sacramento has actually increased a little bit. Sacramento is our newest coalition, but consistently across our 3 coalitions, we see the same. I think interestingly, Marianne, we do have the same top 5. So neuro, GI, rheumatology, cardiology, dermatology. I think endocrine is in our other 2. And Marianne, was there anything that you wanted to share in terms of observation, what you've seen over time?
Yes, thanks, Libby. It's great to be here again. Always enjoy our monthly roundtables. I think the main thing when we particularly look at some of the geographic areas is just based on how many of our practices, our clients, the FQHCs, particularly in these areas, operate. There are times when they have, and if anyone's on from an FQHC, you know this, there are times when you have a very big backlog of referrals, whatever it's your internal process, people may be out on your team, etc. May was that kind of example in the North Rural area. I think that was more of a peak due to just trying to manage coming on new. There was a FQHC that changed EHRs at the time. That's kind of why you're seeing that. So I would kind of view that a little bit as noise in the data line here. And for July, it's just slowed down there for what you said, which is all understandable in the North Rural. Central Valley has really just been, very much key, hanging on. We see some of the same things. Sometimes there's backlogs that not on the ConferMED side, but more on the FQ trying to get referrals in that maybe are timing out in terms of getting, they thought they were going face-to-face and pushing them in. And I think by the time you see the end of July, this is from Monday, we haven't seen this week. And I know from our team, it's a really busy week with the referrals coming in and closing them out. So that's pretty good. But I think Central Valley is really, it's where it is. It's like a 600 a month usage in there, which is wonderful. And also, I think the thing to look at in Central Valley, though, that's important for me when I look at what's being used, they're a geographic area that's using a lot of urology. It's really, it's high up there, right with endocrine when I was looking at the data. So that's an interesting thing. We've brought on another urologist recently to help in there because we've been seeing that trend for urology being used, which is absolutely great, right? For them, it improves access, gets the care, quick response. And then Sacramento, this is our newest area that the coalition has been kind of working in. We've had a lot of practices in there beforehand. That we were working with the FQHCs in the area. So now we've just really, I think with the work of this team here, just brought it more to life there, and utilization is really holding steady where it is, and the access is improving. And this is an area, interesting, that's using derm where the two other areas aren't. So some of that I find fascinating. And whenever I get to talk with any of them in the practices, it's just trying to find out why derm. A lot of it is contracting too. Practices, FQs may have their own derm solution, direct contracting through the payers with a group or something. That's all, viable reasons. But in Sacramento, they're using dermatology a lot more. So, so it's just kind of always when you begin to look at it to see who's using what. And then when you meet with them, you find out the whys.
Great to know. And Marianne, I know you can answer a lot of just the operational questions around what you're seeing, since you have all the data at your fingertips. Do you have any questions from the audience around the data you're seeing? And if you're on mute, you're also welcome to type in your question if you have any for Marianne. So with that, I'll just wait for questions to come in, and I'm just going to ask my own question to Marianne. I think one thing that we've done, I've worked with Marianne and team, and along with our Anthem and HealthNet partners over many years now, and there seems to be a pretty strong trend. You mentioned dermatology, but also with endocrine, and seems to always be in the top 10 of those specialties that tend to be high in terms of requests. Do you have any thoughts of why endocrine tends to be in the top 10, or why people do it more than other specialties? Why they make more requests for endocrine?
So I'll give you mine, right? So just for the folks on the call, just so that you know, I am a registered nurse. I've worked in primary care probably for 20 years before working more in population health. And anyone on this call that is running a practice or has any clinical background knows that between diabetes and thyroid issues, it's a very common on your schedule. Prevalence is there, new cases all the time. So endocrine will always be something that ConferMED, like when we look at our specialists and we look at how many we have for different specialties, endocrine is one of those that we have a really, really deep bench, both in adult and pediatric, for endocrinology, for the reasons of the prevalence of particularly diabetes. And we see a lot of thyroid issues and that coming through the e-consult as well as being something that the primary care providers are looking for more clinical guidance on. But without a doubt, diabetes is our leader, and everyone who knows about healthcare knows that diabetes is, one of the biggest challenges we have, because it requires not just the primary care provider doing the right thing and following the guidelines for how to care for, to do diabetic care in both type 1 and type 2, but also the role of social determinants of health and the most important role of the patient's piece in managing their care. So, when we think about internally, when our team meets, and we have a specialty review committee where we talk about this a lot and what we're seeing in our e-consults, and what the primary care providers are asking, and the challenges that they're facing. And many of those things start coming to play for us, like making sure our specialty network understands the geography they're working in, right? Because there's a lot of medications. I think I read something a few weeks ago that in the last decade, there's 40 new, maybe plus 40, FDA approved new therapeutics for diabetes care, right? That's a lot to add in. And they're not all for our specialists who work in different states, they have to understand what's available, what's going to be covered. Don't come in with the newest, the greatest. We have to be respective of the geographies we're in and how to support the practices there. So when I think about what our team has to do in the different specialties that we're supporting, and I think about diabetes, because we're talking about this call, it all comes into that when we have our communications with our specialists, we're talking about those things. When we did our ConferMED echoes, obviously there was ConferMED echo for a month on endocrinology, and diabetes was a big part of it. It's just talking and recognizing not just the clinical guidelines, but the other pieces that help the primary care provider grow the knowledge, grow their ability to manage it, and understand maybe some workarounds with some of the therapeutic issues in terms of what can be paid for in different programs. So it's probably, I mean, many of you know Dr. Anderson as well. He's the president of ConferMED. Diabetes is kind of his area. He loves it. It's like where he's done a lot of research before being involved in telehealth. And so we see the value. I think everyone here knows the payer side. You see it all the time. You have programs running all around to help patients with diabetes. And that's what we try to get our endocrinologists to do for the primary care provider is answer their questions, but give them additional information so the education's there so that they can use it in that case and the future cases, because it just keeps coming. And I think what you're going to see, Dr. Wilensky, who has done a video that will show, Dr. Wilensky is ConferMED's medical officer. He is a primary care provider in an FQHC. He also is a specialist for ConferMED in our network. He does complex primary care specialty reviews in Connecticut and several other states for FQHCs. And he runs a team of primary care providers who do all of our clinical quality review. So he sees it both from, right now, he's actually in clinic seeing patients where he pre-subs the nurse residency program in Connecticut. He's going to address what he's been seeing in the e-consults and what he knows the specialists can assist in the primary cares with around diabetes, both in type 1 and in type 2. We talk a lot about type 2, but in the world of the FQHC, sometimes the primary care provider has type 1 questions that we were able to answer. And with that, I'm just going to, before we turn over into him, I'm going to talk a little bit about how we've been doing. We're doing a pilot. There's a grant in Illinois in an FQHC that we are participating with. And it's all about using one of the virtual specialists, reading the CGMs, the continuous glucose monitor readings, seeing them, working back with the primary care provider to adjust the insulin doses. This is both in type 1 and type 2 patients, to see the outcomes in that in terms of how did the practice feel about it? How's the patient feeling about it? And is it making a difference in the hemoglobin A1C? So that's something more to come. And I can tell you that our 2 endocrinologists that are doing it absolutely love doing it. So with that, Livia, I will ask if you want to start showing the video of Dr. Wilensky, and then I'm happy to answer questions on it after.
Thanks so much, Marianne. Okay, before I click play, can you see my screen?
Yes.
Great. Okay, here we go. And this is Dr. Wilensky.
Hi. The types of e-consults that come through. And, we do a careful review of our e-consultants, and we make sure that you're getting answers to your questions. So and many of these are questions that I've asked myself, through e-consults to endocrinologists. So, we all know that we're supposed to start metformin for our patients initially, and we usually have our favorites for second choices, but sometimes it's difficult to figure out what's next. And sometimes instead of making a decision when the patient is in the room, it behooves us to say, well, let's see if a specialist would choose a different one than I might choose and give me a good reasoning so I might learn from it and be able to help my future patients better than I have been doing. So how do I decide on the next medication by a patient? This has gotten more complicated as we've had more medications, and we'll go over a case that really goes over nicely. How do I decide on the next medicine? What should my A1C goal be for this patient? That's a tricky one, right? We really should be individualizing our diabetic care based on who the patient is, what the comorbidities are, what the resources are. So many issues go into it. And how attentive the patient is, how much they're willing to do. So we're often a little uncertain. What should we be shooting for? My patient's A1C is 7.8. That seems too high, but maybe it's okay for this patient. What do you think? You know what I mean. So we all know we don't want to be the ones as family practitioners, internal medicine docs. We don't want to be the ones managing type 1 diabetes. I mean, some of you may have some specific extra training, but the average primary care provider is not really well positioned to manage type 1 diabetes. That said, I suppose many of you have patients like I do who have type 1 diabetes and they don't have endocrinologists. And there's usually either good or bad reasons why they don't, but we manage their type 1 diabetes, and the input from an endocrinologist can be really quite helpful. Up until not that many years ago, I always felt that continuous glucose monitors were to be in the hands of a specialist, but that's changed. Really, we can use them in primary care, but how do we create our threshold, and what are the best ways to go forward with getting a patient a continuous glucose monitor when we think that it would be beneficial? And endocrinologists do this day in, day out, and they can help us work through this, and then that expands the scope of our practice and becomes another tool that we have and we're comfortable with. What about you're managing a lot of type 2 diabetics, but some of them have LADA, what is it, latent autoimmune diabetic of adults, and we really should be treating them as type 1. Particularly your thin folk. I always suspected with my patients with a severe alcohol use disorder history who've had pancreatitis multiple times, and I figured maybe they're really type 1 because they don't have much pancreas left. So what do we think about antibodies? What do we test for? We sort of sense that there's something we should be doing, but we're not comfortable enough doing it. Why not wait a couple of days, get the input from the specialist, and then you know exactly what to do. And then if you're not sure how to interpret things, you get another e-consult. Their role is not necessarily to walk us through from beginning to end for everything. They can help us manage along the way. And then, of course, we all have this, I'm doing all the right things, but the sugar isn't coming down. What am I doing wrong, or what else should we be doing? And we see that a lot with our incoming e-consults. So let's go over a couple of examples, and so hopefully you find them helpful. So this is an e-consult about a patient who can't afford the GLP-1 agonist Victoza that has been prescribed. They tried and they're looking for alternatives. And the specialist says, goes over the basal insulin and the sulfonylurea and the metformin. and says, let's talk about adding another agent, and then goes on in subsequent, in subsequent discussion to talk about what medication you might choose. And in this case, instead of the specialist saying, this is what you should do next, the specialist reviews the different agents and goes over how potent they are, what their benefits are, what the difficulties are in using them, what you have to monitor. And notice that it can be fairly extensive. And sometimes specialists will put these things together and then reuse them, and that's fine as long as they're really focused on your patient. Now, in this case, the specialist also says that the GL1 agonists are really quite helpful, and maybe it's just fructosa that's denied by insurance, so you can try something else. And so it doesn't rule it out based on that. I would argue with the increased risk of bladder cancer on the TZDs. I don't think that that's a big issue. But anyway, this might have been an old one. And then the specialist goes on to summarize how to approach this patient and make this decision. Organization can be really helpful when the e-consultants organize their responses. It really helps us follow their instructions and learn from them. We want to make sure, by the way, that there's education in pretty much every e-consult you receive. Let us know if there's anything any e-consult you receive that don't seem, up to par or what you're expecting. Please let us know. We have a pretty rigorous process for that. So let's go over the next case. This is the primary care provider is struggling with the control of a type 2 diabetic who's also cirrhotic, which of course is probably making them extra concerned. Patients on 70 units of Toujeo and 88 units of meal with Humalog average. So obviously the patient is doing some adjustment. You might have to look to the progress note to see what how the patient is doing it. So essentially is asking, how do I optimize insulin therapy? And so the specialist asks for a lot of sugar. Now, of course, the patient with uncontrolled diabetes and cirrhosis may have gotten there by lack of attention to their health, and the patient may not be able to do this, but that doesn't mean the endocrinologist should not recommend it. And then using those patterns, you decide how you're going to adjust things. And very clearly the specialist is going to talk about how to adjust the Humalog with the meals. And if the patient is able to, this is how the patient should be determining how to go over the Humalog. And also mentions that this person is, not using the term, but there's a term that endocrinologists are using now called over-basalization, which I think we're all guilty of. It's easy to keep going up on the basal insulin when the patients aren't controlled. But at some point, we're using too much basal and not enough, and it's either time to start coverage of meals or tune up coverage of meals. And so he's commenting the patient over-basalized and cutting down on from 70 units to 40 units, and we're going to go up on Humalog, and this is how we do it. Here are a couple of dietary suggestions. Quickly limit rice to 1 measured cup, and increase vegetable intake, and then goes over some very specific ways of approaching it. And then, of course, you can then adjust these based on how the patient responds. And that is really all we prepared. When you listen to this recording, you'll also be able to ask some questions, and Marianne can forward anything to me if there's any reason why you would want to ask me any questions. But we're just hoping that you find the e-consults to be helpful for diabetic patients and for all, many of your outpatient considerations. Diabetes being a particularly useful one for us. So we hope you find it helpful. And if there's anything else that you are hoping for from it, please reach out to us and let us know. Well, thank you so much for your attention. Good luck, and thank you for the amazing work that you do. without what you do, there would be a lot of people in a lot worse shape. Take care.
So I'll pause for a sec to see if anyone has any questions for ConferMED, and Marianne is here to be able to respond to any of those. Looks like right now we don't have any coming in. And I also welcome other providers who may be on. If you have personal experiences doing e-consult for endocrinology, we welcome those stories too. We always like to hear how it's working in the field or if there are any challenges. Marianne, did you want to elaborate on anything that Dr. Wilensky said?
No, I just want to emphasize what he said, that, we thank the practices for trusting us in selecting our specialists and getting them the information they need. We too learn a lot just by doing this to keep improving and finding out what's best for the practices, what they need.
That's great. And I'm going to step back. We launched into Dr. Wilensky since you did such a nice introduction of him, Marianne, and I wanted to apologize. I muted myself because I didn't want to have any background noise when Dr. Wilensky spoke, and I ended up muting him. So you missed just a few seconds of introduction, but I did paste in the recording. So you have that full recording if you wish to share with any of your providers. I think we just missed Dr. Wilensky providing some general background. So, but you have that link if you'd like to share that. And just to step back a little bit, why did we do this today? Why did we talk about diabetes? Obviously, Marianne showed that there are trends for diabetes being one of the biggest types of requests that we're seeing come through in your coalition work or your clinic work. But also this is something that we're seeing as a trend across the state. This came to light, I saw a health affairs edition devoted to this month. That obviously across the country, diabetes is a challenge that we're trying to address. And now we have, Karina, Lily, Mark, correct me if I'm wrong, but we probably have around 20 counties participating in our coalitions at this point. And it's a problem across our counties. It's a trend. This is just a quick little snapshot. And if you look at California map here, the darker the county color, the more challenge we are seeing in terms of health factors, access to care, health behaviors, access to ability to address these through primary care. So just wanted to share some highlights that we want to be able to identify and address. So these are counties that are participating in our coalition, and every one of these counties is struggling with diabetes prevalence, higher than average. The California average is 9% of diabetes, 9% of patients having diabetes. A number of our counties are struggling with that. Also, in terms of just the health factors challenges across the state, you can see a number of our counties are really struggling with ability to access care, and one of those specialties is diabetes, as you know. So what's great to see, and Marianne, you mentioned there are some great publications that Dr. Anderson has contributed to and authored around the promise of e-consult to be able to help with diabetes care. This was a more recent publication that I thought would be interesting to share with you all. Just the top line about this is that continuous glucose monitoring enhanced with e-consult resulted in improved outcomes with regard to not only providers' experiences, but patients' experience. And so similar outcomes in person. So it's something that can be managed through e-consult or assisted through e-consult. And just some other trends. I mentioned this health affairs article. Just it's clear that across the country, telehealth and e-consult are being used. And we've had ups and downs. I think one thing that you've probably all noticed is that engaging patients in technology to manage diabetes can be challenging. However, e-consult is perhaps lower impact on patients, and that providers can communicate without having to layer on any extra asks of the patient to be able to manage their diabetes care. And then last, we know it's an access challenge. We know both primary care and endocrinology access are challenging. And without the ability to create more endocrinologists in our counties, this is a means of extending access and perhaps addressing some of those less urgent, those non-urgent, more routine, more medication-related requests. And just as you mentioned, Marianne, I didn't know if you wanted to add anything in terms of diabetic retinopathy. I think you touched upon it earlier, but just a reminder that eConsult can be supported through the retinal cameras that many of you have in your sites. And Marianne, I think you touched upon that. Is there anything else you wanted to add?
Yeah, I just want to just share with any of the practices that are out there. We're really lucky that the payers of Anthem and HealthNet have worked with ConferMED to cover retinal readings through the eConsult process, which is really absolutely amazing to help the practices get there. And the practices have received cameras either through grants, through some of the payers. Many of the practices have these cameras to do the retinal readings that will work in the eConsult platform. ConferMED specialists are out of UC Berkeley's IPAX group. So we have it all in place. And if you're a practice that has a camera that's independent of, knowing whether it works with the eConsult IPEX process, just reach out. We'll take a look at what model camera you have and determine that. And it just really is another way, particularly to close care gaps around retinal readings.
Thanks, Marianne. And while I still have you, just wanted to note that this is an opportunity in Fresno and Tulare counties. Kauai Health, if we have anyone from Kauai, you're welcome to speak up here. That this is an exciting opportunity for education for Fresno and Tulare providers. Marianne, did you want to mention anything about Dr. Barr's presentation?
Yes, no. So Dr. Barr was really interested. She's one of the endocrinologists in the ConferMED network. She's done a lot of speaking for CMEs, for different organizations, for ConferMED, was part of our ConferMED Echo program, and just really was very gracious when we asked her to do this, and was totally on board, and looking forward to seeing this, well attended. She'll be focusing a bit on new therapeutics and other techniques for managing diabetes that I think will be helpful, as well as the lens will be completely through health equity.
Thanks so much, Marianne. And I do want to note, this is a Tulare Fresno focused webinar. This is a great idea if you have this kind of forum in other counties in the North. If you have an opportunity where we can come and present these kinds of educational topics, if there's an opportunity to provide CME around eConsult for your providers, we're happy to set that up. So do reach out, and I'm happy to extend this kind of opportunity in different county settings. I did copy the link for Tulare and Fresno providers in the chat, and I'm not sure, Karina, if you have anything to add, but please do if you have any detail that you wanted to add. One thing I also wanted to do is just pause a moment. One of the things that we have seen over the past couple of years is that this time of the year brings in another layer of stress for providers. We're already dealing with COVID and other environmental stresses, but with wildfire season coming, it's already been brought to light on what's happening in Mariposa near Yosemite. We're thinking of you if you happen to be in that area. And we know that this is happening once again. We're anticipating a bad fire season. So we wanted to stop a minute, think about, and give our plans opportunity to talk about some of the resources that are available to providers as we enter fire season. Also just knowing that there is not only a mental health, a stress that is brought on with fire season, but also physical challenges. They are things that can be managed through eConsult. If we're talking about patients who have asthma issues, patients dealing with smoke, this is something that can be dealt with through eConsult. But on the bigger picture, we all want to make sure that providers know that there are resources available to them for general care. So I'll stop for a moment. And I know Lily and Karina, you wanted to mention some resources. Lily, do you want to go ahead?
Yeah, could I share my screen?
Sure. Oh, you know what? Let me make sure that you can do that.
I can.
Okay.
Can you see my screen?
I cannot yet.
Oh.
Let's make sure you can do it.
Maybe it'll work better.
Oh, yeah. Okay. Now you're okay. Now you're good.
Awesome. Thanks, everybody. My name's Lily Clements. I'm our eConsult program manager over here on HealthNet's virtual care team. Thank you so much for having this event, Libby and Marianne. So I just wanted to note that our population health team is responding to the emergency in Mariposa County through several avenues. Some of the team members are doing outbound calls for some of our members, but we're also deploying some resources to the emergency evacuation shelter there. And so one of them I just wanted to show just a picture of what it looks like is a kiosk that actually members and just general members of the public, they don't have to be HealthNet members, can access resources, but they can also, if they are a HealthNet member, access Babylon for any telehealth or teledoc. So I just want to note we have these kiosks that are centered on the county they're specifically in. So they're programmed with county specific resources. So just want to show that. And then we also have our RVs there that help with resources and really just connecting members, to the care that they need, because I know it can be a fairly chaotic time. And then I also just wanted to show, this is just our flyer. This has information, like you were saying, Libby, there's such a need for physical as well as mental health services. So we do have a phone number on this flyer to help members with getting their prescription if their drugstore is closed. So I just wanted to point that out here on the right. And then as well as just a mental health line, mental health helpline that's open 24 hours a day. For our members, who are dealing with grief, stress, or trauma related to the wildfire. So, we want to do what we can to provide the resources to them. And I can share this flyer with you as well, Libby. That would be helpful.
Thanks so much, Lily. If you have a link, feel free to copy that into the chat too, if you have that electronically.
Okay, thank you.
Great. And I know, Karina, you wanted to touch upon some of the Anthem resources that are available too.
Yeah. Hi, everyone. This is Karina Mendoza with Anthem. I just, really wanted to highlight a little bit on the e-consults first before I go into some additional resources. But, and with these wildfires, individuals are losing their homes and vehicles, causing them to be displaced, and for some to no longer, have means to transportation. Individuals may be presenting to their local primary care provider and seek resources to maintain care with their specialist. One option may be to schedule transportation, but I would just also like to mention that, PCPs and referral teams to consider using eConsult. An eConsult can be submitted to a ConferMED specialist and then get recommendations back on a treatment plan within 72 hours. So the PCP can then review the recommendations with the patient and decide to follow those recommendations. And so it's really I just wanted to highlight, the use of eConsults and even this situation and how it can benefit both the patients by receiving timely care and also the PCP because, they're advancing their scope of practice and learning how to initiate those care plans with the guidance of the specialist through the eConsult. So in addition to using eConsult as an option during these times with the wildfires, Anthem has also opened up our Live Health Online medical and behavioral health telehealth provider app practice. So that is open to across California for any residents that are impacted by a wildfire. They can go on Live Health Online either through a mobile app or through one of our digital kiosks and schedule an appointment and see a provider through the app. If there's any need for any emergency relief telehealth type equipment, we have our digital kiosks that can be deployed. So if there is any need, anybody on the call that has a need for that type of equipment, you can reach out to me and I can work with you to get a kiosk deployed. So.
Thank you so much, Karina and Lily. I think we will make sure to get these resources out to you all. So you'll have these links to resources even outside of eConsult, just those that are most important for access to care during this time. And we're thinking of you all if you happen to be in Yosemite area, just please, we hope that everyone is safe. And just last, as we wrap up today, just a couple of reminders. We've heard today also that, there is continuing need for pediatric care access. We heard that around diabetes, but also we hear frequently that there are needs for child and adolescent behavioral and mental health support. So I think you've all heard, if you've been on our past calls, there is the Child and Adolescent Psychiatry Portal program that is a hybrid eConsult / telephonic eConsult or consult program connecting primary care providers in your counties to specialists who are sitting at UCSF Children's in Oakland. So this is available free of cost to any of your providers. I just realized I don't have the link on this slide, so I will get that back to you in the chat in just a moment here. But this is a program that not all of you have gotten up and running on yet. It is free to you, and we want to make sure that you have that at your fingertips. So if you have any questions about it, please do let us know. And a couple other announcements. We want to share stories, and some of you have mentioned we'd love to hear, patient and providers' perspectives on how this all works. I'm not going to play this for you right now because of our time constraints, but I will copy it in to the chat, and you all have these slides in your mailbox. If you got the deck for today's call, that Alyssa's story is at your fingertips. It's just a quick 3-minute story of how a patient benefited from eConsult, a well-spaced patient who was dealing with multiple comorbidities. And Alyssa just really brought to light exactly how this works in a patient's life. So we do want to hear more of these stories. If you would like to share a story from your provider's perspective, we're happy to extend a stipend to cover that provider's time. And last, as I lose my voice, we want to touch upon one of the big issues that we're hearing from you all, is that mental health, not just child and adolescent, but adult mental health, is still top of mind for many providers across our counties. And with that comes our challenges with substance use disorder. So we'd like to spend time on our next month's call focusing specifically on this substance use disorder as it relates to mental health and how eConsult can be used to address these challenges. So please save the date for our next call, August 24th. And we will make sure to get that invite on your calendars very soon here. And last, if you happen to be in Northern California, we are looking forward to an in-person meeting. This is a project supported through California Healthcare Foundation, enabling us to meet once a year to discuss eConsult. We're doing this in person in Sacramento, so if you're able to, this is available to you free of charge. Meeting in person November 9th at California Endowment in Sacramento. So with that, I think we'll wrap it up. Unless we have any words from Karina and Lily. Any last words before we wrap it up, or questions from the group?
Well, thank you, everyone.
Thank you.
Great. Thanks everybody for your time today. We look forward to seeing you next month. Bye-bye.